Welcome to the office.
Hi, Trudi.
Hi.
Welcome back.
It's nice to be here.
It's been a few months.
Yes, it has.
So, what did you come for?
Just for follow-up.
Okay. Now, what did you originally come for?
Oh, what I originally came from. I've been struggling with some back pain,
Okay.
mid-thoracic.
That's right.
Some hip and leg pain.
It was a little more than that.
A little.
You came all the way from Kansas.
Yeah, it was pretty bad.
Right? It was pretty bad.
Yes.
And how you came for a few days?
Yes.
How did you do?
I did amazing when I got home. It was night and day.
What's different?
I don't have the mid back pain hardly ever,
Okay.
unless I overextend or, try to do something that I shouldn't be doing, like bending over and picking up something without using my legs or.
Okay.
And
So it's changing those habits also, right?
Yes, it is.
And we started the process. And a lot of people ask, right, that, what are we doing? And we're helping people get back into alignment,
Yes.
changing the habits. And as long as those habits continue to change, you're also mindful, right?
Absolutely.
And so we're here for a follow-up.
I am.
All right. What's going on today?
I'm starting to feel like I'm regressing a little bit.
Okay.
I've been having some left hip pain, and then that right tingling and numbness sensation has come back in my lower leg, and then my neck is just not quite right.
Well, it's been the summer, and you had harvest season.
I did.
So, and how big is it? Sorry.
It's big.
It's big, right?
It's big.
It's
but
pretty big.
I don't know how many weeks. We were there probably the better part of a month on harvest.
Okay.
And I was able to sit in that combine and not have a lot of difficulty. It was amazing.
That's awesome.
Yes.
And how many years has it been?
7.
7 years. Okay.
Since I can sit still for very long.
All right. You ready to get started?
I am.
Let's do this.
I am.
Awesome. You're here just for a couple of days, right?
I am, and then I'm going to fly back home.
All right. Harvest is over. What do you guys got going on for the winter then? What do you guys do out there in the winter?
Well, I pretty much do basketball and
Basketball?
help the school out. Yes.
Right on. You coach or you volunteer?
Well, I volunteer, and I keep the books, and I'm also a senior sponsor this year.
Very nice.
And so we're doing scholarships and things like that.
All right.
And then in the spring, I coach junior high track, and I love that.
Oh, that's awesome.
I love that.
That is awesome. You ready?
I am.
Okay. So
I'm kind of sweaty. I'm sorry, I was walking.
let me clean it up. So our last adjustment, we were at L5 and the occiput.
Right.
And I don't need to take new x-rays unless there was a new injury. There was no new injury.
Nope.
And, people also ask that, right? Like, is everything changing overnight? No.
Mm-mm.
Now, I have a lot of cases where I re-x-ray sooner than later, and we get to see those great changes. In your case, we're looking at more long-term. Starting at the base of the neck. Head down, please. All right. And we're getting it up top. 8, 9 points. Right side, occiput. And what else has changed in terms of activity? Were you doing any of the stuff we talked about?
Yes, and I've been walking quite a bit and jogging a little bit here and there and just doing basic yoga and strengthening.
Okay. Did you get the yoga ball?
I have a yoga ball, yes.
Okay. And we talked about sitting and bouncing on the yoga ball.
Yes.
Which works really well. I'm getting a little bit down at T5, T6, 6 points. Yeah, I think it was time for a tune-up.
Yeah, I was feeling like.
So we're going to continue down low, 7, 8 points, sacrum, T5, T6, and occiput.
Well, I'm consistent at least.
Yes. So nothing new showed up. That's the good news.
That's good.
Static palpation.
I think my swelling is a little better.
Swelling is a lot better. And we're going to compare this. There is swelling, but we're going to compare it to our first and second visit and see. And we can see right there, it's pretty red. You've been drinking your water?
I'm trying to. I'm a little dry right now.
Yeah. 7, that's 6, that's 7.
7.
You can see they both have what's called pitting edema. There's a pit that stays there. If I go down here, it goes away faster. So we're going to go with 7. Let's check the hip motion, feet together. And my fingers are right there on the SI joint. Scoot forward, please. Feet together. Open and close the knees with the feet touching. Feet are touching together. Open and close the knees. Open and close. Keep going. Open and close. Left side only. Left side only. Open and close. And when she does the left, the right shifts with it because of fixation. I'm just going to show my thumb. Go ahead and do the left side only. When she does the left, my right wants to shift with it because of that fixation on the right sacrum. Right side only, please. And when she does the right, the left is good. Okay. Scoot back for me, please.
Okay.
And let's go ahead and palpate the sacrum. That's sacrum. That's 5. Actually, it's 5.
That one hurts there a little bit.
Sacrum too? I think we'll probably work on the sacrum on this visit, and the next one we'll get to that 5.
Okay.
Yeah. Okay.
But
So,
I'm so much looser,
okay.
you know, and I don't wake up as exhausted as I was.
Okay.
I think I'm sleeping better for sure. I'm still struggling trying to sleep on my back, though. My jaw's probably a little bit weird, too.
You want me to work on your jaw?
If you could.
Sure, absolutely. 1, 2, 3, 4, 5, 6. Well, the good news is, yeah, it is consistent.
I am.
It's actually consistent. Sit back for me, please. Let's see if we can go a little deeper today for you. Let's check the neck. That's 7, 6, 5, 4, 3, 2, I may have to do the 1 first on the left and then get to that occiput. Let's nod the head. Nodding, primary motion of the occiput is nodding up and down. Left side, right side. Right there.
Yeah, it gets crunchy when I go to the right.
Yeah. Okay, you ready?
I'm ready.
Let's do it.
Okay.
C1. And for her C1, I have to bring my elbow down just a little bit because of the angle of C2. Nice and easy there. Hi. Clunk. Nice. You know what? I just want to move this.
I know. I have so much hair.
You're good. Right there. There we go. Now for the occiput. Right side. Good. Right. You actually are more flexible this time. Oh.
I'm pretty flexible.
Drop. There you go.
There it went.
Gotcha. Walk it off once, please. Okay. Now, you remember, we're going to do sacrum here.
Yes.
When it's time for 5, we're going there tomorrow.
Okay.
Okay, let's go on the high-low table. Let's go ahead and do 7 first. 2, 3, 4, 5, 6, 7. Now, her 7 is kinked on that right side. So let's start it on the right side. I want to be on the high side of the rainbow. 2, 3, 4, 5, 6, 7. Get the tissue out of the way. Get right on that bone. That's the home run. They're nice and clunky today.
They are, aren't they?
Yeah. For the sacrum, I'm going to be on that right side. Let's use the drop. Nice and easy there. There it is. That's a piece. That's not all of it. And then we're going to go left side down. Sorry.
Wonderful.
Okay, let's go left side down. I'm going to be right there on the tailbone, on the sacrum, sorry. Hold the wrist. I want to make sure we straighten out the leg. When the leg or the knee is bent, it contracts the hamstring. It makes the adjustment a little bit harder. Nice and easy. Hold the wrist. Hold the wrist. Good. That's the home run. Take your time. Take your time. Take a nice deep breath.
No.
There you go. Okay. Walk it out.
Yes.
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 Yes. Good stuff. Walk it out.
Wow.
You're still holding a lot of some emotion from last visit.
Well, you know,
Different emotion.
you deal with it as much as you can and all the ways you can. And then that's when I know it's time to come see you.
I got it. But I'm glad that it held quite a bit.
It really honestly has.
It's been, what, 3 months?
I think 4
4
and a
months.
half.
4.5 months.
Yeah, I do believe so.
Yeah, I'll look at the notes. Come on over.
Okay.
Have a seat. I'm curious. Let me go
Oh.
back. Our last visit was June 1st. We're October. 4 months.
Yep.
Very cool. Not bad. Starting at the base of the neck. Clear. T7 is clear. And let's check below. Low back is clear.
Love it.
Let's recheck. Back slowly.
Oh, yeah.
Sacrum. Bueno.
Yes.
And now look at 5 also. Good. Nice.
Miracle worker.
Awesome. Alrighty. Let me go ahead and do the buff and polish.
Okay.
Vibration. Then I'll work on the jaw, okay?
Okay.
Got it. Now make sure you get lots of walking while you're here, okay? It is it's about 80 degrees today.
It's nice. 150% humidity.
There you go. Right side, right shoulder, let me do the work. Left side, let me do the work. There you go. Ears. And now let's check the jaw. Center on the chair for me, please. Center. Put some gloves on.
So I had a sinus lift procedure.
You had a what, sorry?
A sinus lift procedure
Okay.
because I've had some major bone loss in my upper jaw. I've had a chronic sinus infection, they thought, for years. And so when I went to have implants put in, they couldn't put them in. There wasn't any bone there.
So what did they do?
So they went in and opened everything up, cut me underneath on my face, and then put a bunch of cadaver
On the right side?
on the right.
When was this?
July 28th, 29th. And I had sutures for 3 weeks. And then I've been a lot better, but I have to have the second side done first week in November.
Okay.
And so it's just one of those things, but I know he pulled on my jaw really hard.
Let's take a look.
He said I have a really small mouth.
Sit back for me, please. Slowly open the mouth. Slowly close. A little bit there. Open. Little deviation on that from right to left. Open all the way. We're going to set it as a right AI. Open. Slowly close. So what I'm doing is I'm guiding it back in. And of course, after that, there's some soft tissue work. There's some icing that happens as well. Open. Close. Bueno?
Yeah,
Open.
lots better.
Open. Close. There you go.
Thank you.
There you go. Let's check the hands.
Okay.
Stand up for me, please. Squeeze. Squeeze. Don't take yourself so damn serious, girl. BJ used to say that, BJ Palmer. There you go. Squeeze. Capitate, lunate. Scaphoid. Elbow. A little more. There you go. Squeeze. 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 Welcome back. Good to see you.
It's good to see you guys too.
Good to see you.
Could you look at my foot real quick?
Yeah, go on your back. Bilateral AS talus. Fibula. Raise it up. Talus. Fibula. There you go.
Thank you.
You're all set, my dear. You enjoy your day. I'll see you tomorrow.
I'm excited.
All right?
Thank you.
Squeeze. All right, we're good.
Okay.
Good to see you again.
Good to see you too.
You take care, my dear.
I will.
All
Thank
right.
you.
You're welcome.